The medication that I prescribed was ferrosulfate. The reason why I prescribed this medication is because of the condition of iron sufficient deficiency anemia. From the word itself, there is not enough iron in the body. Our body is made of blood. 67% of it are red blood cells, also known as the RBC. So the RBC needs the iron to be matured and be healthy. So it can deliver blood that contains oxygen, which is necessary for us to breathe, and minerals and nutrients, which our body needs in our daily lives. Imagine the red blood cells, the RBC, is a car. It carries oxygen and other nutrients and minerals to deliver to other part of the body. In order for this car to have to transport this oxygens and other kinds, it needs the gas. The gas in this in here is the iron. As I mentioned earlier, it needs maturity, and it helps the RBC. Insufficient gas for this car, we're gonna wear off the car. So just like in our body, in not enough iron will will and not enough iron will gonna lead to depletion or not being able to meet or deliver the oxygen. We will have shortness of breath, tired, we're gonna feel dizzy, we will appear pale, like no colors, and we're gonna have a brittle nail and weakness. The need for iron is increasing during pregnancy, periods of growth in children, those teenage boys and girls, and during menstruation. So that's why we are giving supplemental iron in the form of like ferrous sulfate, so that it will help to increase the transportation of nutrients. So in taking this ferrous sulfate, you have to take it with vitamin C or citrus. Then avoid uh, taking it at the same time with milk, antacids, or any other antibiotics such as tetracyclines and canolos, because these medications, like the antibiotic, will decrease its effectivity. So whenever you were given like a drop form or a liquid form of this medication, use a straw because it has a tendency to stain stain the teeth. And then also food can decrease iron absorption by around 40 to 60%. So, if necessary, if you need, it's better that it's taken in an empty stomach. However, to lower down or to reduce the irritation, it can be taken with food with a small feeds only. And then our goal here is to monitor the hemoglobin and the hematocrit. The RBC or the red blood cells, our car contains also hemoglobin, which we're gonna split it into two, the heme. So we're gonna take the heme. The heme contains a blood that is the indicative, or this is like we needed this part for a value uh, that we needed this value to be normal. Normally, if you have iron deficiency anemia, your heme or the hemoglobin is low. So it's for the normal for that we're trying to achieve for a man is 14 to 18, and for woman is 12 to 16. So you are in a RBC, an increase in RBC for the red blood cells for the total of half to at least 1.5%. So you will be expecting that you taking of this medication will gonna be in a month, and then after a month there will be another blood draw that needed so that we know if we're achieving or we have to do some revision with the prescription. So there will be like a month or 3 months um, treatment. What I mean by treatment is like when you take the you might expect that you'll be gonna be taking it 1 to 3 months of this ferrous sulfate. So the side effects or the stuff that you might experience in taking this medication is like constipation. Constipation is when you wanted to go to the do number two, but nothing is coming out. It's either hard or it takes days before to go. It's not the usual bowel movement. It's taking longer. Diarrhea is when you have a lot of you've been going a lot and than usual and in watery form. And nausea is like you feel like you wanted to vomit, but like throwing up, the urge of throwing up, and then vomiting is the vomiting itself. And then anorexia too. Anorexia is like you don't want to eat, loss of appetite. Also, it is expected that you're gonna see your bowel movement. There will be a coloration like greenish and a dark color, like it could like black color um stool. So that's expected. What is not expected is when you have after taking this, you have reaction to it, like you feel like anaphylactic siya. What I mean by anaphylactic is like when you feel itching, short or like your pipe is narrowing, there was rashes or